Hi there, my name is Richard Marler, and welcome to my mediation and therapy practice. I thought I'd spend a few moments to speak about one of my specialty therapy areas of practice. So, I'm a registered psychotherapist and I'm an individual, relationship, family, and co parenting counselor and psychotherapist. Now, within the family therapy, there's also a little subspeciality that I offer, which is reunification therapy. Now, this draws on my over 2 decades experience in the family law sector and also over 6 years experience as a therapist. It brings all of this experience together in being able to hold space for a very nuanced and complicated area of therapy, which is trying to reintroduce a child to their parent. So, generally, the context of this is where a child is somewhat estranged from one of their parents. And often, what happens in these situations is a child feels caught between a conflict between their parents. Often, the non rejected parent will have ideas about the rejected parent that they are somehow clinically narcissistic in some way. And that projection can often filter through, even by the most well meaning of parents, that can filter through to the child. And in response to that, quite often the rejected parent has ideas about the non rejected parent that in some way they've been engaged in parental alienation. More often than not, there's neither parental alienation or clinical narcissism at play. More often than not, what's at play is a child has not had their needs met by a parent and for whatever reason, and therefore have developed an insecure attachment to that parent. So the idea of reunification therapy is to try to address that. Now, I adopt a 4-stage process. So stage 1 involves an individual therapy session with all family members involved in the intervention. It allows me to do a bit of psychoeducation. It allows me to do a risk assessment with each person individually. And it also allows me to build some rapport to start the process. Then I'll engage in a focused stage 2, which is therapy with the child, for at least 3 sessions. And that's where I explore deeply with them what their resistance is to the rejected parent. I'll also engage with both parents throughout this process to keep them informed, and also particularly with the rejected parent to give them insight so that they could possibly address the child's needs. Stage 3 is where the child and the rejected parent will spend time together. Now, that'll be done very carefully and very gradually. It might start with the parent attending some sort of extracurricular activity within eyesight of the child. It might then move to some brief interactions in public places. And finally, it might lead to one-on-one time between the child and the parent. After stage 3, we move into stage 4, which is evaluation, where I will have a session with the child, and then I'll have a session that I share between the parents. It's either a joint session or I'll split it between them, where we evaluate the intervention as to its effectiveness, and sometimes we might move back into the stage 2, where I engage in some deeper therapy with the child and possibly also with the rejected parent. So that's my process for reunification therapy. It's a very difficult area of practice, and I'll be honest, more often than not, it's not successful, and that's not to blame the non-rejected parent in any way. It's just sometimes very complicated, children's relationships with their parents, and when there is a large rupture, it can sometimes take years or even decades for those ruptures to heal. So that's a little bit of insight into my reunification therapy practice. If you're considering it, I'm more than happy to have a confidential chat with you about it to see whether it might be the right fit for your situation. Thanks.